Welcome to Through Our Eyes, where we see thyroid eye disease through the lens of those who live it every day. I'm your host, Andrea Perryman. Before we dive in, I want to remind you that everything we discuss in this episode is intended for informational purposes only and should not be construed as medical advice. Please consult with your doctor or healthcare provider for any medical concerns or treatment decisions. Also, if this is your first time tuning in, be sure to hit that follow or subscribe button so you never miss an episode. And if you're watching us on YouTube, go ahead and tap that subscribe button too. We've got so much more coming your way. Being diagnosed with TED didn't just change how my eyes looked, it changed how I saw the world. I was first diagnosed in 2016, and back then, treatment options were scarce. There wasn't much information out there, and certainly weren't any support groups. I felt completely alone, like I was the only one going through it. And that's why I created this podcast, because no one should have to walk this road in the dark. Through Our Eyes is the resource I wish I had when I was first diagnosed. In today's episode, we're diving into topics that could change the game for anyone navigating this condition. Imagine waking up one day and not recognizing the face in the mirror. Your eyes are itchy, watery, red, and starting to bulge out. At first, you might think it's just allergies, but then things get worse, fast. And suddenly, you feel like a stranger in your own skin. For people living with thyroid eye disease, that's not a bad dream. That's reality, every single day. But here's the good news. We're living in an extraordinary time in the world of oculoplastics and thyroid eye disease. For centuries, TED remained a misunderstood and underdeveloped area of medicine. But today, that's changing. New research, groundbreaking therapies, and surgical innovations are transforming how we treat this disease and bringing renewed hope to patients around the world. TED is complex. It demands a personalized treatment approach, sometimes medical, sometimes surgical, and often a mix of both. If you're struggling with TED, it's absolutely essential to seek care from a specialist who understands this disease inside and out. Today, we're joined by someone at the very forefront of that innovation, Dr. Raymond Douglas, a world-renowned oculoplastic surgeon with offices in Summerlin, Nevada, and Beverly Hills, California. Dr. Douglas has pioneered surgical techniques that have restored not just vision, but confidence and quality of life for thousands of patients. His research has reshaped our understanding of how TED progresses and how we can intervene sooner and more effectively. This conversation just isn't about medicine. It's about identity. It's about visibility, and it's about the courage it takes to ask for help. So whether you're living with TED, love someone who is, or simply appreciate stories of remarkable medical breakthroughs and human resilience, this episode is for you. There are a few different types of doctors who can diagnose and treat thyroid eye disease, and depending on what's going on with your eyes, who you see really matters. One specialist you'll hear about, especially if you've done any late night Googling, is an oculoplastic surgeon. Now, I know oculoplastic sounds like the kind of word you'd only hear at a medical spelling bee. And honestly, I pray that none of us ever has to spell it under pressure. But these are highly specialized surgeons who treat some of the most complex conditions involving eyes, eyelids, and surrounding structures. And when it comes to TED, they often play a critical role in both diagnosis and treatment. So I started asking Dr. Raymond Douglas to break it down. What exactly is an oculoplastic surgeon, and how do they help patients with thyroid eye disease?
An oculoplastic surgeon is actually a little different than a facial reconstructive surgeon. So oculoplastic surgeons typically go through ophthalmology training, learning all about the eye and the eye diseases, and then subspecialize for typically 2 years in an additional fellowship where we do all surgeries around the eye. The most common procedures I perform and is a little probably different than the average oculoplastic surgeon. Most oculoplastic surgeons do a lot of eyelid abnormalities, raising the eyelids, blepharoplasties, etc. And I do those, but I do most of my surgeries focused at least 75% on thyroid eye disease and improving patients' outcomes and even their aesthetics. So I may move a patient's eye back with a decompression and cause less bulging, but then I will also then potentially do a blepharoplasty or a brow lift or fat injections, etc., to also kind of give them back the appearance that they had prior to this disease overtaking them. And sometimes those are different procedures than they would normally have just for an aesthetic procedure, and sometimes they're the same. It has to be individualized.
It's important to remember there's no one-size-fits-all approach to treating TED. Some patients respond well to medical therapy, others may need surgery, and for some, it's a combination of both. So I asked Dr. Douglas how he approaches care, how he tailors treatment to each patient's unique journey with TED.
Yeah, a lot of my patients come in asking me about medical versus surgical therapy. And honestly, it kind of has to be tailored to the patient. So there are a lot of patients where I do just surgery. I do a couple hundred decompressions and surgeries a year, but I also treat a lot with medical therapy. I think it's really important to seek out some counsel to help give you both the pros and cons of both sides, because both are very reasonable therapies that we didn't have 5 years ago. But definitely seeking out a specialist who can give you the pros and cons of both in your certain circumstance is really important, because the medical therapy now has really changed how we treat this disease, but it's not perfect. And so a lot of times we still, resort to surgical therapy also. Having a trusted provider helping guide you is really important in this process.
Finding the right doctor, someone who can walk you through your options and help you make the best decision for your case, can make all the difference. Everyone's experience with TED is different, and sometimes it causes visible changes like droopy eyelid or under eye swelling. In most cases, surgery might be part of the conversation. But here's the thing. Some patients feel conflicted. They wonder if it's vain to want to fix something that's considered cosmetic, even when it's clearly affecting how they look and how they feel. So I asked Dr. Douglas, do patients ever feel guilty for wanting to undergo surgery?
Yeah, that's an amazing question, Andrea, because the guilt that you get from wanting to have reconstructive surgery, or what I call aesthetic reconstructive surgery, is really real. And I didn't actually understand it until a lot of my patients would ask me. He said, do you think I'm vain for doing this, or do you think I'm, being, going too far? And my patients, the way I often now proactively kind of diffuse this a little bit, because my patients, none of them come in wanting to be Beyonce. They don't want to come in being the next top model. They want to kind of show me a picture of what they looked like 2 or 3 years ago and say, hey, can you get me to 75% of this? They're incredibly realistic and thoughtful about this and about the risks and benefits typically of moving forward. And so I think that that's certainly something I didn't realize and didn't properly apprehend and understand, but now try to proactively diffuse, because a lot of patients don't ask that question, but I know they're thinking that.
I really resonated with Dr. Douglas's insight about how practical patients actually are when it comes to these decisions. This isn't about vanity, it's about identity. They're not chasing perfection, they just want to recognize the person in the mirror again. At some point, every patient asks the same thing. Why me? Why did my body suddenly decide to turn on my eyes? That's not very nice. So I asked Dr. Douglas, what kinds of questions do patients walk in with, and how does he explain thyroid eye disease to them?
Yeah, so common questions are, what caused this and why did I get it? And that's a tough one for me, because a lot of times there's no clear-cut reason as to why someone gets it. Sometimes it's a little bit of genetics that line up against you, but it's not completely. And sometimes it's just chance, and that's the case for autoimmune conditions. So what I usually do is I try to start and explain what the disease is. The disease is really your immune system, and namely your bone marrow, that attacks two receptors. One is on the thyroid and one is around the eyes. And by attacking these two receptors, you get these two weirdly different diseases. One that controls your endocrine system and then one that causes your eyes to go crazy. But they're because these receptors are actually physically linked that causes this disparate, kind of clinical condition. And then the conversation inevitably turns to, well, what can I do about it? And that's when there's been kind of the most excitement, but the most confusion, because now there's medical therapies, surgical therapies, etc. So the common questions are, why did I get it? What can I do about it? But then that usually leads into a whole host of other, things, that kind of dive into their individual circumstance.
There's no one reason why someone develops thyroid eye disease. Multiple factors might be at play. And while researchers are still working to understand the full picture, the why me doesn't always come with a clear answer. TED is layered. It's not just about what's happening on the surface, it's about what it takes from you beneath it all. The emotional toll is real, and for many of us, it's just as heavy as the physical symptoms. Because TED doesn't just change how you see, it changes how you feel about being seen. So I asked Dr. Douglas how he sees the emotional impact show up in his patients' lives.
So patients handle it, differently, but most of my patients usually withdraw. They withdraw socially, withdraw from their family, really don't want to engage in any additional social experiences, and can even withdraw at work. No longer want to go to the meeting or do the presentation or things like that, because it really saps their confidence. And one of the biggest thing I see is, as post-surgery, is even beyond just their appearance change, it's how they're much more confident. And many of my patients, they may not even have severe disease, but they look so different than they did before. Their friends or family will always ask them, what's wrong. But if you met them for the first time, you may or may not even know that they necessarily had thyroid eye disease, but it still tremendously impacts their social abilities and their confidence. And I think that certainly something I see across the board.
I've always been fascinated by how closely we connect symmetry with beauty. We don't even think about it every day, but our brains just register balance as familiar, comforting, and healthy. So when something like TED comes along and shifts that balance, it doesn't just change your face, it changes your relationship with the mirror and with yourself. TED affects more than just your eyes. It can alter the shape and proportions of your entire face. And when that happens, it shakes something much deeper. Because this isn't just about physical appearance, it is about identity. There's a quote that I love: "Beauty is how you feel inside, and it reflects in your eyes." But for so many of us living with TED, that reflection feels distorted, both literally and emotionally. So I asked Dr. Douglas about the work he does to restore symmetry and why that kind of healing goes far beyond skin deep.
Symmetry is something that I look at every day in patients with thyroid eye disease. And when I look at symmetry, there's several different ways to look at it. And everyone has a little bit of a symmetry. Some people have longer, thinner faces, or a wider, shorter face on one side versus another. And that's part of beauty, and that's part of how we do fillers and surgery and think about that all the time. The part that's unique with thyroid eye disease is there's also a symmetry of face of more proportions, where your forehead consumes a certain proportion, your eyes consume a certain proportion, and then lower down in your face. And rhinoplasty surgeons and such use these proportions, etc., too, in reconstructing the face as to how much each of those units should kind of take up. And in thyroid eye disease, your eyes go out, but they also separate. They also widen. And that creates two things of symmetry, right? I mean, one is the disease sometimes is not symmetric. It just pushes one eye out more than the other. But all of a sudden now your eyes are wider, which throws off your proportions. And the eyes are bigger, which totally throws off your proportions. And usually the disease causes an expansion of your lower face, kind of squaring that off. So when I have that discussion, we address each of those proportions: brow height, the eye prominence, and then even the lower face, how we can even narrow that lower face and kind of get those proportions and symmetry back. So I think it's really important, and sometimes it's hard for patients to define because they just say, I look different. And unless you really break it down, you can just kind of pass over those comments and not do much about it.
Listening to Dr. Douglas talk about how TED can disrupt the symmetry of the face really hit home for me. That was one of the hardest parts for me personally. I remember avoiding mirrors because every time I looked at my reflection, I was reminded of my disease. When Dr. Douglas broke down all the small and specific changes that can happen, it made me think of something I've heard so many patients say. I just don't look like me anymore. It's not always about one big thing. It's this combination of subtle shifts that slowly start to distort your sense of self. And that's the thing about TED. It doesn't just affect your eyes, it affects who you are. No wonder so many patients struggle to explain what's changed. They just don't know something feels off. And what I appreciate most is Dr. Douglas gets that. After spending so many years helping patients navigate this journey, I was curious, what keeps Dr. Douglas coming back?
Honestly, dealing with my patients is the fun part of my day. There's a lot of other stuff that's less fun, and insurance companies and all that other kind of stuff. But the real fun of it, and the thing that keeps me coming back every day and keeps me leaving with a smile, is really dealing with patients and really having those success stories where we've either done surgery or medical therapy, and they're incredibly appreciative because they've gotten back even some semblance of their lives. And as I said earlier, my patients are very realistic, and they're looking for an improved quality of life, and that's usually something that's very possible in our field. And so, unlike many other fields in medicine, you don't see gratification, and here we do, either surgery or medical therapy. In a relatively short period of time, patients can have a very significant improvement, and honestly, that's the delight.
As we wrapped up, I asked Dr. Douglas what he'd want someone to hear if they were feeling overwhelmed by the burden of thyroid eye disease. Maybe overwhelmed by all the information out there, or just feeling alone in it all.
The burden of this disease is great, and there's a lot of information and even misinformation out there. And what I find is a lot of people try to find information or are confused by the contrary information, and it's just hard to distill. And then maybe patients just kind of shut down, or because it's just either confusing or contradictory. What I'd say is, happy to consult with those patients we do online, but also even if you find a thyroid eye disease specialist, sharing those concerns and really going to someone who can give you both pros and cons of different therapy and help guide you through this process that is often very confusing, but at least presented in a way that, that here's what we know and here's what we don't know. We don't know every step of how the path is going to unfold, but this is what we'll do if this happens or this happens. And just knowing that someone has been through this before and can help guide you can often overcome the burden and the discontent of the thoughts that it's just, it's a little overwhelming. And so I think, taking that one step at a time is a really important approach, especially with someone a thyroid eye disease specialist who can help guide you through that.
There's such wisdom in that approach, finding someone who can help you navigate the uncertainty one step at a time. On that note, I asked Dr. Douglas to share where listeners can learn more about his work and how to get in touch if they're looking for expert care.
I am Dr. Raymond Douglas. I'm an oculoplastic surgeon in Beverly Hills and also in Summerlin, Nevada. RaymondDouglasMD.com is our website and our best way of contacting any of our practices.
I want to thank Dr. Raymond Douglas for sharing his incredible expertise and insights with us today. What stands out to me most isn't just his surgical skill, but his deep understanding of the emotional journey TED patients experience. The desire to simply just look like themselves again, to regain confidence, and to re-engage with life. I'll be honest, when I was first diagnosed, I had no idea what TED was. I just knew something wasn't right. That's why conversations like this matter so much. If there's one thing I hope you take away from today's episode, it's this. If you're living with thyroid eye disease, you're not alone. This condition affects every aspect of your life and how you see yourself, how others see you, and how you navigate the world. But as we've heard today, there is hope. There are specialists who do understand, and there are treatments that can help you reclaim not just your appearance, but your sense of self. For those of you supporting someone with TED, whether you're family, friends, or healthcare providers, I hope this conversation helps you better understand the profound impact that this disease has, not just physically, but emotionally and socially. Until next time, this is Through Our Eyes, where we see the world from new perspectives and bring invisible struggles to light. If you enjoyed this episode, please subscribe wherever you get your podcasts and consider sharing your story with us. We'd love to have you as a guest on our podcast. Through Our Eyes is a Bloodstream Media podcast and hosted by me, Andrea Perryman. If you'd like to sponsor the show or get in touch, you can reach us at mailbag@bloodstreammedia.com, and we'd love to hear from you. For more inspiring content and conversations from the Bloodstream Media Podcast Network, visit bloodstreammedia.com. Thanks for being here, and I'll see you next time on Through Our Eyes.